PURA NATURA is presenting. Our bodies are intricate orchestras, with each mineral playing a critical role in maintaining harmony. Copper and iron, two essential trace minerals, are key players in this symphony of health. Although we require them in small amounts, their impact on our well-being is profound. Copper, often overlooked, is vital for forming red blood cells, just like its more famous counterpart, iron. It acts as a powerful antioxidant, protecting our cells from damage. Furthermore, copper plays a crucial role in energy production and maintaining healthy nerves and bones. Iron, a powerhouse in its own right, is best known for its role in transporting oxygen throughout the body. Hemoglobin, the protein in red blood cells responsible for carrying oxygen, relies heavily on iron. Additionally, iron contributes to energy production and supports a robust immune system. Together, copper and iron perform a delicate dance, their roles intertwined in maintaining our overall health. Understanding these minerals and the consequences of their imbalance is crucial for achieving optimal well-being. Copper deficiency, while less common than iron deficiency, can have significant implications for our health. This deficiency arises when the body lacks sufficient copper to carry out its essential functions. One of the hallmark signs of copper deficiency is fatigue and weakness, often accompanied by shortness of breath. Inadequate copper levels can lead to anemia, a condition characterized by a deficiency of red blood cells or hemoglobin. While iron is essential for our health, too much of it can tip the scales from beneficial to detrimental. Iron overload, also known as iron overload disorder, occurs when the body absorbs and stores excessive amounts of iron. This condition can lead to a range of health problems if left untreated. One of the initial signs of iron overload is fatigue, a seemingly paradoxical symptom shared with iron deficiency. However, in the case of iron overload, fatigue stems from the deposition of iron in organs, interfering with their normal function. The liver, heart, pancreas, and joints are particularly vulnerable to iron accumulation. As iron overload progresses, individuals may experience joint pain, particularly in the knuckles, hips, and knees. This pain arises from the deposition of iron crystals in the joints, leading to inflammation and discomfort. Abdominal pain is another common complaint, often attributed to iron accumulation in the liver. Furthermore, iron overload can disrupt the body's hormonal balance. Men may experience erectile dysfunction and loss of libido, while women may experience irregular menstrual cycles. These hormonal disturbances are linked to iron's impact on the pituitary gland, which regulates hormone production. Copper deficiency and iron overload, while seemingly disparate conditions, share a common thread: the delicate balance of minerals in our bodies. Understanding the contrasting features of these conditions can shed light on their individual implications and guide us toward maintaining optimal health. Copper deficiency, often characterized by fatigue, weakness, and neurological impairment, stems from inadequate copper intake or absorption. This deficiency can result from malabsorption disorders, inadequate copper intake, or excessive zinc consumption, which can interfere with copper absorption. On the other hand, iron overload, marked by fatigue, joint pain, and hormonal disturbances, arises from excessive iron absorption or intake. This condition can be hereditary, caused by a genetic predisposition to absorb more iron than necessary. Alternatively, it can be acquired through excessive iron intake from dietary sources or supplements. The contrasting nature of these conditions highlights the importance of balance. While both copper and iron are essential, their levels must be maintained within a narrow range to ensure optimal health. Understanding the causes and symptoms of both copper deficiency and iron overload empowers individuals to take proactive steps toward maintaining this delicate balance. Section 5. Bridging the gap, dietary strategies for balance. Achieving a balance between copper and iron levels can often be achieved through dietary modifications. By making informed food choices, we can influence the intake of these essential minerals and support our overall well-being. For individuals with copper deficiency, incorporating copper-rich foods into their diet is crucial. Seafood, particularly shellfish like oysters and lobsters, are excellent sources of copper. Other good sources include nuts, seeds, organ meats, and whole grains. In cases of iron overload, reducing iron intake through dietary changes is recommended. Limiting red meat consumption, which is high in heme iron, a readily absorbed form of iron, is often advised. Avoiding iron-fortified foods and beverages can further contribute to lowering iron levels. Moreover, certain dietary factors can influence the absorption of both copper and iron. For instance, vitamin C enhances iron absorption, while calcium can inhibit both copper and iron absorption. Being mindful of these interactions can help individuals optimize their nutrient intake. Section 6. Copper deficiency, delving deeper into the causes. While inadequate copper intake is a potential cause of copper deficiency, several other factors can contribute to this condition. Understanding these underlying causes is crucial for effective prevention and treatment. Malabsorption disorders, such as celiac disease and Crohn's disease, can impair the body's ability to absorb nutrients from food, including copper. These conditions damage the lining of the digestive tract, hindering the absorption process. Excessive zinc consumption can also interfere with copper absorption. While zinc is an essential mineral, consuming it in large amounts can create an imbalance, as zinc competes with copper for absorption in the intestines. Certain medical conditions, such as Menkes disease, a rare genetic disorder, can impair the body's ability to transport and utilize copper. This condition affects copper levels in various tissues and organs, leading to severe copper deficiency. Furthermore, prolonged use of proton pump inhibitors, PPIs, a class of medications used to reduce stomach acid production, can interfere with copper absorption. PPIs raise the pH of the stomach, making it difficult for the body to absorb copper effectively. Section 7. Iron overload. Unraveling the mechanisms. Iron overload, often associated with hereditary hemochromatosis, can also result from other underlying causes. Understanding these mechanisms is crucial for identifying individuals at risk and implementing appropriate interventions. Hereditary hemochromatosis, a genetic disorder, is characterized by increased iron absorption from food. Individuals with this condition inherit gene mutations that disrupt the body's ability to regulate iron absorption, leading to excessive iron accumulation over time. Frequent blood transfusions, while life-saving in many medical conditions, can contribute to iron overload. Each unit of transfused blood contains iron, and repeated transfusions can gradually increase iron levels to unhealthy levels. Certain types of anemia, such as thalassemia and sideroblastic anemia, can also lead to iron overload. These conditions impair the body's ability to use iron effectively, leading to a buildup of iron in the blood and organs. Excessive iron intake, often from supplements or iron-rich diets, can contribute to iron overload in some cases. While less common than hereditary causes, excessive iron intake can overwhelm the body's ability to regulate iron levels, leading to potential health problems. Copper deficiency, symptoms and health impacts. Copper deficiency manifests in various symptoms from subtle to pronounced. Neurological symptoms include numbness, tingling, and weakness. Anemia, characterized by fatigue and pale skin, is another sign. Osteoporosis, weakening bones, is linked to copper deficiency. Copper deficiency also impairs immune function, increasing infection risk. Section 9. Iron overload. Recognizing the signs and long-term consequences. Iron overload, if left untreated, can have significant long-term consequences for various organs and systems in the body. Recognizing the signs and seeking timely medical intervention is crucial for preventing irreversible damage. Liver damage is a serious complication of iron overload. The liver is a primary site of iron storage, and excessive iron accumulation can lead to inflammation, scarring or cirrhosis, and an increased risk of liver cancer. Heart problems, including heart rhythm abnormalities, heart muscle damage known as cardiomyopathy, and heart failure, are also associated with iron overload. Iron deposition in the heart can interfere with its electrical and mechanical function. Pancreatic dysfunction, leading to diabetes, is another potential consequence of iron overload. The pancreas, responsible for producing insulin, can be damaged by iron accumulation, impairing insulin production and increasing blood sugar levels. Joint pain, particularly in the knuckles, hips, and knees, is a common complaint in iron overload. Iron crystals can deposit in the joints, leading to inflammation, pain, and stiffness. Section 10. Diagnosing and treating copper deficiency and iron overload. Diagnosing involves medical history, physical examination, and lab tests. Tests guide treatment decisions. Blood tests are crucial. Copper deficiency tests measure copper and ceruloplasmin levels. Iron overload tests assess iron, transfer and saturation, and ferritin levels. Imaging tests assess iron accumulation in organs. Liver biopsy may be necessary. Treatment involves copper supplementation. Addressing underlying causes is crucial. Section 11. The path to balance. Prevention and long-term health. Maintaining a balance of copper and iron involves a holistic approach to health. Through informed dietary choices and regular checkups, individuals can prevent and manage copper deficiency and iron overload. Consuming copper-rich foods like seafood, nuts, seeds, and whole grains is essential. Some may need copper supplements under professional guidance. Preventing iron overload involves limiting red meat and iron-fortified foods. Hereditary hemochromatosis may require regular phlebotomy. Regular checkups and hair analysis are crucial for early detection and management. Subscribe for more videos.